Hello everyone, my name is Faramade Iranga. I am a doctoral student at Bradman University, and this is my Stakeholder Educational Plan video. Before I begin, I'd like to give a little background about myself. I have been a nurse for over 10 years, and I currently work as a nurse practitioner in acute pain management in one of the hospitals in the state of Maryland. Today, I will be presenting to my stakeholders an educational plan. To understand who my stakeholders are and why I have chosen this group of people, I would like to briefly explain my scholarly project. My project is to introduce an antibiotic stewardship program in outpatient setting to reduce the inappropriate use of antibiotic for the treatment of upper respiratory infection. Let me give a little overview of the problem. The discovery of antibiotic for the treatment of all manner of infection have been a major breakthrough in medicine. It has been associated with many life-saving events, especially in the prevention of infection post-operative and in the use of treating infection that resulted from surgery or other chronic diseases. Antibiotics have become a go-to medication for many providers. This has led to its misuse and its overprescription. You would notice that I'm focusing on outpatient clinic. I'm focusing on this clinic because overprescription is becoming commonplace in outpatient practice. I have personally seen this in my practice as many patients seek medical attention as soon as they begin to experience respiratory symptoms such as a cough, sneezing, congestion, and most likely they're expecting to get a prescription for an antibiotic. The purpose of the advent of antibiotic has changed. There needs to be a way of preventing overprescription and misuse. Overprescription and misuse has led to healthcare system being plagued by resistant strain of bacterial infection. This epidemic has even led the White House to create a national action plan for combating antibiotic-resistant bacteria with one goal of reducing inappropriate use by 50% by the year 2020. Now, I've talked about resistant strain bacterial infection. What is resistant strain bacterial infection? Jane O'Doherty in 2019 explains that antibiotic resistance is the power in which pathogenic bacteria possesses to inhibit the performance of an antibiotic drug. In a simpler definition, which was provided by the Centers for Disease Control and Prevention, antibiotic resistance happens as a result of bacteria subduing the effect of antibiotic, thereby reduce its ability to perform its intended function. Now, who are my stakeholders in this project? The objective is to introduce an antibiotic stewardship program to potential stakeholders in their administrative and clinical capacity in order to achieve a reduction in the misuse of antibiotic. The following stakeholders are important and crucial to the successful implementation of this evidence-based scholarly project. I have identified the CEO of the practice, providers, which would include physicians and nurse practitioners. Also would be the registered nurses, medical assistant, receptionists, the patients, and their families. Now let's talk about their role individually. The CEO will provide authorization to acquire and utilize resources for the implementation and usability of the project. The providers, who we have earlier identified as physicians and nurse practitioners, will perform electronic medical record audits of charts based on antibiotic prescribed and to track trends, also to compare them retrospectively and prospectively. Providers are also responsible for performing an in-depth assessment of symptoms to determine which requires the use of antibiotic. The registered nurses, medical assistant, and receptionists are the frontline staff who will be part of patient education during triage. The patient and their family will be given educational materials to recognize their symptoms as they are part of the shared decision-making process. Let's talk about the theoretical foundation and conceptual framework for this project. The theoretical framework for this project is based on the Lowen model of change, which utilizes 3-step change theory necessary to the project with an expected result of decreasing inappropriate use of antibiotic for the treatment of upper respiratory infection. According to the Journal of Innovation and Knowledge, theories of change represent the advantages that an organization have to modify their strategies, processes, and structures. Now, having identified the change model that I want to use, let us talk about the 3 steps in the Lowen change model. The first step is called unfreezing. Unfreezing consists of examining current practices and create an environment that is conducive to change. The second step is moving and freezing. In this step, it can be explained as rearranging priorities to find a new balance in safe patient care. It is in this step that the project is implemented. The third step is identified as refreezing. In this step, outcomes of the project will be reviewed for areas of improvement and how to maintain the change. The conceptual framework for this project is the Plan, Do, Study, Act model, or simply called the PSDA model. Now, I chose this theory to test the change in real time. According to the Institute of Healthcare Improvement, the PSDA circle is an action plan for learning. As the name of this model suggests, for the success of any project, it is important to plan it, try it, observe the results, and act on what is learned. Now let's talk about the educational need for each group. The educational need for the CEO would include reviewing the purpose of the project and the goals of the project. The CEO will be responsible for communicating the new project to the staff, the patients, their families, and the CEO will also be responsible for providing resources and support for all identified. Let's talk about the educational need for the provider. And to remind us who the providers are, have been identified as the physicians and nurse practitioners. The educational needs for the providers include a review of the purpose and the goal of the project. Is to review current treatment guidelines and application of the treatment guideline, as the providers will be providing assessments to patients. Educational need for the RNs, the registered nurse, and the medical assistant, as well as the receptionist, would include an overview of the requirement, review of new tools that will be implemented during triage, as they will be introducing educational material to patients during triage. The educational needs for patient and family includes overview of the project, like creating awareness of the shared decision making, educating them about the antibiotic and when they are necessary. Let's talk about how I plan on delivering this intervention. For the purpose of this project, 3 simple steps have been developed to achieve and deliver the intervention. The first step is to assess. Assessment is key in order to identify the problem, assess the need for the project, and develop a PICO question. The second step involves conducting an extensive literature review on the problem. Not only on the problem, conducting a extensive literature review on the proposed solution, which I've identified earlier as implementing an antibiotic stewardship program in outpatient setting to reduce the problem of overprescription of antibiotic for the treatment of upper respiratory infection. The third step is the development of the project plan itself, identifying the project goals and who the stakeholders are. During this step, an educational review plan will be created for all stakeholders and initiation of feedback process, tracking and reporting, and peer review. This step will also involve scheduled meeting with staff at least once a week in order to provide updates on the project, on the progress of the project, and address staff opinions about the change process, especially knowing that conflicts will arise and barriers. With ongoing feedback, each feedback will be reviewed as the project evolves. And this is done to identify the unique features that might be pertinent to the success of the project. Thank you all for watching my educational video plan.